Hi, I'm Virginia Doran of luminousbeauty.com, and I want to welcome you to another edition of To the Point, a show very generously produced by the American Acupuncture Council. Today, I'm extra delighted to have as my guest Dr. Marc Grossman. When I met Marc in 1992, we were both going to acupuncture school in New York and Connecticut. But Marc is very unusual in that he holds licenses in both acupuncture and is a doctor of optometry. And to fulfill his dream of practicing holistic and integrative eye care, he's fully trained in acupuncture, even though he didn't need to be practicing. And he's also trained in nutrition and vision therapy. And he saw this significant void in holistic eye care, and not only filled in to practice that way himself, but he trains practitioners internationally, online and in person. And he's published many books. The four ones that are probably most notable and appropriate for this audience is Natural Eye Care, a comprehensive manual for practitioners of Oriental medicine, where he goes into both acupuncture and herbal prescriptions. And then he has a book, Natural Eye Care, Your Guide to Healthy Vision. They sound similar, different book. It's an 800-page text, and it covers about every eye condition from both a Western and Eastern perspective, plus nutrition and supplements, herbs, clinical tips. It's really a must-have for every practitioner's library. He's also written a book, a very interesting book, very unusual, Greater Vision, a comprehensive program for physical, emotional, and spiritual clarity. Another thing that he teaches about. And the international bestseller, Magic Eye Beyond 3D, Improve Your Vision. Um, so you can find more information about his books, trainings, his specifically designed products, but also about many, many different eye conditions. His website is full of information. He's very generous with his knowledge as he shares it to people. And that's naturaleyecare.com. So after that, um, I asked you to speak on this because I think it's so necessary, and there's not much training or awareness of this in our field, and also I think that if you could give some examples of, like, say, glaucoma, for instance, a common condition, that to give an idea how you work, the in-depth approach you have to things. So thank you so much for being on, because I know you're in the middle of your work day. So if you can tell us how you got into this, maybe very briefly, and then what you want to impart.
Oh, thank you so much, Virginia. And I'm very, very grateful to you, Dr. Alan Weinstein, who's a master of putting this out, the American Acupuncture Council, because I believe that knowledge is power. And we're all trying to have our patients and society become educated consumers. So as much as we can share knowledge, as much as we can share what we know with each other, the better. And it's very interesting. I was meditating this morning and I was saying, oh, I think I know what I have to start with saying. And you said it beautifully. How did I get into this? Acupuncturists usually have a drive. It's like, oh my God, this is my calling. This is my calling of what I want to do in life. And my story was I was already an eye doctor for 16 years, had just finished paying off my student loans. And then I went to a friend's house, and in the middle of her living room was one of the first books in the Western Hemisphere on acupuncture called The Web That Has No Weaver. And I felt it. I could remember it like it was yesterday. The book looked at me. I looked at the book. I said, I can't believe I got to go to acupuncture school now. But I thought I had a way out because acupuncture wasn't licensed in New York State yet. And as you know, as one of my classmates, we had to go to school in Connecticut first. So we went to school in Connecticut for a year, and then we spent our next 2 to 3 years in New York City. So I said, well, I guess I gotta go. I don't know why I'm going. I just know I have the calling. And we're going to talk about the calling. We're going to talk about those moments in our life that we get those signals of what we need to do and how our vision, how not only our outer vision, but our inner vision affects how we are in life and how it affects eye conditions. And we are in an epidemic. That's right, an epidemic in society right now. Do you know that over 90% of young adults from 14 years and younger in China and Japan are nearsighted? If you don't consider 90% epidemic, then
Wow.
nothing is,
Yeah.
and with the advent of computers and being online. So we need to take care of our eyes. And as we know in Chinese medicine, and if you can go to the first slide, Alan, we know that all the meridians go to the eyes.
Mm.
All the meridians go through the heart. So when we are working with people with eye conditions, acupuncture, Chinese medicine, I believe, is an integral part of the integrative medicine team that needs to be to help these conditions. I About a month or two ago, I lectured at the East West Integrative Medicine Department at UCLA that's been going on for over 25 years. Oh my God. And we did an international conference, which I was part of the panel on Chinese medicine and vision. So the need is there. There are some amazing acupuncturists, like one of my colleagues and co teachers, Dr. Andy Rosenfarb, who specializes in vision and Chinese medicine. So, what I want to really put out today is how important and how Chinese medicine can be part of that team. And myself, and I've been practicing for over 40 years as an optometrist. And what are we up to now, Virginia? 26, 28
26, I
years?
think.
26 years as an acupuncturist. And I didn't even know when I was in eye doctor school, optometry school, and I would say, excuse me, why did they get a cataract in their left eye and not their right eye? And they go, you mean you want to know why? I said, yeah, I'd like to know why. And Ted Kapchuk said it beautifully. He said, in Western medicine, in which I was trained, we look at how does X cause Y? But in Chinese medicine, what do we look at? What is the relationship between X and
Mm.
I? X and Y. And I believe that all disease, dis-ease in the body mind has to do with relationships, relationships to our environment, to the trees, to the oceans, to our families, to our friends. And what is the goal of every acupuncture or Chinese medicine treatment? Balance and harmony. And when we have balance and harmony, and Chinese medicine speaks about it beautifully, we have no stuck energy. And I believe, in my experience, that almost all eye conditions are due to stagnant energy. So let's go to the next slide, Alan. Integrative medicine and vision. We need an integrative approach. I lectured at the Integrative Healthcare Symposium, and there were acupuncturists in the audience, functional medicine doctors, naturopaths. Yes, I always tell people who I see, I'm just a little part of your team. We want to do integrative medicine. Next slide.
Can I interrupt a second? Yeah, I
Sure.
went recently to an eye doctor to, just have a checkup and tests, and I don't think I'd actually ever done that as an adult. And, they dilated my eyes for something. They put some other drops in. I mean, for 3 weeks, I could barely see. And my eyes didn't adjust back, the dilation, but they were cloudy from the second they put the first drops in. And, all they could suggest was a drug. And they said, oh, yeah, it's no problems with it. But I looked up the side effects of the drugs. It was every organ, and it was going to change. It could change the color of your skin, your eyes. But they thought, oh no, this is totally benign. So there's such a need for what you do, and for some and others to know about it. Really, we all should be trained in this specialty, because it's, what's going on is kind of barbaric, really. Anyway, sorry to interrupt, but
Oh no, you never interrupt,
and
Virginia.
and and yet at the same time, I talk to you about it, and you're like, oh, we have technology and ways to do it that you don't have to be dilated. Oh, there's different versions of these different medications without the preservatives that cause a lot of the effects, side effect. Why don't other doctors know this?
So, as somebody in both professions with both hats on, eye doctors are really, really nice people. They really try hard. But as we know, with most Western medicine, we have limited things in our toolkit. We have medication, we have surgery, and that's it. We are looking at the eye as an isolated organ. I had a patient I'm going to see later, at my last patient today, because she was told she has eyelid cancer. But I started talking to her, and what are the lids related to in Chinese medicine? The stomach and the spleen. Is she having problems with her microbiome? Is she having gut issues? Is she seeing a functional medicine doctor? Yes, but the eye doctor said, "Oh, you've got bumps on your eyelid. Maybe it's eye cancer." But I'm just saying we need to look at the relationships. And remember when I just said before, "Oh, why'd you get a cataract in your left eye before the right eye?"
Mm.
Chinese medicine, in most people, right eye, father eye, male eye, yang eye, left eye, feminine, yin, receptive. So when I really look into why somebody develops macular degeneration, glaucoma, cataracts, and why they may get it in one eye versus the others, I'm going to talk to them. What's going on in their relationships with their father, with their
Mm.
husband? I mean, I've got stories. I've got stories, after 40 years. So let's keep going, because this is just a preview, because I really want acupuncturists to get the power that they have for this kind of treatments. My website, Natural Eye Care, started about 20 years ago. My business partner in that is Michael Edson, and Michael is an acupuncturist also. So we refer to acupuncturists all the time because it's both our bent. You
Mm.
see a phone number there, 845-255-8222. The direct number for Michael, which is the new number on our website, is 845-475-4158. But you can go to the website, and Michael loves talking to acupuncturists, and we are there as a service to help you work with your patients. Next slide, Alan. These are some of my books. Beyond 3D Magic Eyes. Those of you who are old enough know about these 3D pictures that you relax your eyes and then a hidden picture comes out. It was published. Uh, they sold over 30 million of those books. I wrote two of them. I'm the medical consultant to them. I got there after they sold the 30 million, so I didn't really profit from it. But those magic eye pictures are one of the tools I use, not only to help people's eyesight, but to help reduce liver stagnation through the eyes. The Greater
Mm.
Vision book was written because I do believe in the body, mind, and spirit of all eye conditions. Natural Eye Care, that I wrote with about 25 years ago, which was the book before its time, with a good friend of mine, Dr. Glenn Swadout, who's in Hawaii. Um, and then we can go to the next slide, where we expanded on it to that 800-page, 2,000 peer-review references book on natural eye care. And that book is also available on Amazon and on Kindle. And we also divided it into about 5 or 6 smaller books, because that's a very heavy book. But it is. I have had 10 different doctors help me with it, so it is a really good resource. Next, Alan, next slide. So let's talk just a little bit. The only thing worse than being blind is to have sight but no vision. Where does vision happen? It happens in the mind. That was a quote from Helen Keller. Next slide. Dalai Lama. In order to carry a positive action, we must develop here a positive vision. One of the real keys in Chinese medicine is the person has to have it in their belief system that this kind of thing can help. You know, we're not there to convince people. We want people to feel positive, and if they can conceive, if they believe it, they can conceive it. Next slide. This is something which my Magic Eye books are based on. Vision is the art of seeing what is invisible to others. You know, we need to see the bigger picture. And what does Chinese medicine do? It sees the bigger picture. Next. And this is how I sign all my emails. And I'm going to give you all my personal email today because you'll see if you have any questions that come up. Because the question is not what you look at, but what you really, really see. Next slide. And here we go. No, let's go. We got to go to Shakespeare. The eyes are the windows to your soul. We know about that, people. The Shen, the spirit, the pilot light. Our eyes tell us how much our spirit is connected with our soul. And I believe that through the eyes, we can help people go through their soul's journey. Next. And Benjamin Franklin, an ounce of prevention is worth a pound of cure. So nutritionally, Chinese medicine wise, if we can get people on good visual hygiene, the dentists talk about dental hygiene, floss your teeth, brush your teeth. But we're on computers. The average is 11 hours a day on digital devices. We need to do visual hygiene. We need to take care of our bodies and our mind. Next. And this is the integrative medicine approach, which is, I think, the Chinese medicine approach. Imagine a world oriented towards healing rather than disease, where physicians believed in the natural healing capacity of human beings and emphasized prevention above treatment. In such a world, doctors and patients would be partners towards the same ends. And that's why the minimum I'll see patients or clients is I say, I want you to come in after we've worked for a while, once a season. As the seasons change, as you are going to be relating to your environment different, then we need to do a tune-up. So on all my clients, I say the minimum I'm going to see you is once we get everything balanced and in harmony is once a season. Next slide. So these are some of the allied complementary practitioners I might refer to for different eye conditions. An acupuncturist is right there, and even though it's not on top, let me tell you, my partners in my practice, one partner is a chiropractor, and the other partner is an acupuncturist. So acupuncture and chiropractic are some of the biggest referrals that I make in my integrative team approach, along with naturopaths and functional medicine practitioners. But at different times, I may use any of these different complementary practitioners. Next. This is the office I rent space in. This is the outside. Next slide. The reason I'm showing you this is the waiting room before COVID, where now we have people 6 feet apart. Next. Next slide. Contact lenses. Next. Because contact lenses, from an acupuncture standpoint, what they do is for people who are very nearsighted, they create a larger retinal image size. So actually just switching people as an eye doctor from glasses to contact lenses may open up a whole way of less liver cheese stagnation. This is some of the high-end technology that's available today, and I can help you as acupuncturists read the reports on this and talk to you about the findings on some of these tests in terms of Chinese medicine. These are pictures underneath the retina. They take pictures underneath the macula, underneath the optic nerve. They take a 3D picture of the eye. And as Virginia said, many times we don't have to even dilate the eyes. Do you know, as we said, the eye embryologically, physiologically, and neurologically, what is it? It's brain tissue. If you can change your
Mm.
mind, you can change your eyes. We all know about the neuroplasticity of the brain. Therefore, we have neuroplasticity of the eye. And do you know that you can diagnose Alzheimer's disease early through retinal photos? Yes, this thing is out there.
Mm.
So the technology today in the eye will give good insight to people's eyesight. Next slide. Okay, let's go to slide 23. So, as I said, the eye is brain tissue. Do you know that there's studies that in multiple personality disorders, they all had different prescriptions? Ah, very interesting. Mind, body, spirit. Next slide. And trigger points. Both me and Virginia, we had the pleasure and the utter gratitude that we were able to learn from one of the pioneer of trigger points, Janet Travell, who wrote these two giant books, even bigger than my book, on trigger points. And when I learned that, it's the neck, the shoulder, the upper trapezius, going to the sternocleidomastoid, up to the suboccipitals, that many vision problems come from. Because why does that happen? Because people have poor posture when they're on
Mhm.
devices.
And
They hold
yeah.
the tension. Exactly. Next slide, Alan. The splenius cervicis, the neck muscle. So when we're doing trigger point therapy, we can help with pain in the eyes. We can help with glaucoma, which I'll talk about very briefly after. But I really wanted you to know that trigger points, whether you do it through deep tissue or you do it through acupuncture, could be very, very helpful in treating eye problems. Next slide. Again, the SCM, a biggie player, especially with musicians, especially like violin and viola players.
Oh.
Because those people, I've got studies on how that affects astigmatism. So, yeah, the eye and the body and posture are very related. Next slide. The psoas muscle, if you have a tight psoas muscle, sometimes it relates to a vertical imbalance between the two eyes. So again, we have to look at the whole body. Next. Okay, that's it for the slides, Alan. Thank you. So I've got about 6 minutes. I'm going to give you an overview of glaucoma because glaucoma is so, we can do so many things because glaucoma is a disease of the optic nerve. But the only thing that eye doctors have in their toolkit for glaucoma is medication with lots of side effects and surgery. And they even have people, and then all they say is, oh, we just have to lower the pressure. But look at that. Here's the optic nerve. Yes, according to physics, if you lower the pressure in the eye pressure hitting the optic nerve, that'll be helpful because the higher the pressure, the more it could possibly break down the optic nerve. Normal pressure in glaucoma is between 10 and 22. But wouldn't it make sense to also build up the ocular blood flow to the optic nerve? Wouldn't it make sense to work on neurodegeneration? I mean, that's what the eye research is showing. We want to have um, things that are helpful for the nerves. So nutrition, very helpful for that. Alpha lipoic acid, N-acetylcysteine, sublingual vitamin B12, the B vitamins. So nutrition, very helpful. Acupuncture, super duper. for helping with ocular blood flow and circulation. Because circulation, that's why studies show that as little as aerobic exercise 4 times a week can help with lowering the pressure. But what is one of the some of the main things in Chinese medicine? We all say liver, 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 and eyes, but in Chinese medicine and glaucoma, liver is a big player because it's the stagnant liver qi that can add to a liver hyperactive liver yang that can cause a high eye pressure. So I'm always trying to bring the pressure down. Bring it down. I want to deal things with the earth element. I may have them stand in dirt, rub a ball on kidney 1, bring the energy down. So liver 3, liver 8 for blood, gallbladder 20 to release the tension in the occipital, suboccipitals. So liver, kidney, very, very important, especially sometimes the pattern is kidney yin and liver yin deficiency. So this is where it gets a little tricky. There's like 6 different kinds of glaucoma. Some glaucoma is more due to inflammation, such as pseudo-exfoliation glaucoma. Some glaucoma has normal tension, normal eye pressure, but has what we call large cupping in the optic nerve. And therefore, we can lower the pressure, but it's more about getting more blood flow to the optic nerve and helping the nerves. And then there's the glaucoma that has high eye pressure. But again, the toolkit for eye doctors is just lower the pressure. So we can see very easily how Chinese medicine can have an effect. And going back to the Mahdi Bind spirit, stress. Oh my God, they've studies that show that stress can increase the eye pressure. So even in the regular literature of Western medicine, so we want to relax. That's why my favorite formula that I created with my acupuncture partner, Jason Elias, we call it revision. And what is it based on? Buplorium and peony combination. Why? Because what is that called? Relaxed wanderer. And I added some bilberry and some ginkgo, and I added a little lychee and chrysanthemum to bring energy to the eyes. So we really want to do Western Chinese herbs, coleus, an Ayurvedic herb that's very good to lower eye pressure. So I really, what I really want to share with you and hope you get, and if you want to learn more, I am totally available. My personal email is drgrossman2020@gmail.com. I really want to let you know that the ability for Chinese medicine to help with chronic eye conditions and basically all eye conditions is there. That niche, that place that if you really into it, that you want to add to your practice is there, and you will have patience. My friend and colleague Andy Rosenfarb is busy, 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 and he trains acupuncturists in a special kind of acupuncture called microacupuncture. So again, thank you so much for your attention and your time and hopefully listening to this. Again, knowledge is power, and I hope that you become part of an integrative medicine team to help people in the world keep their precious gift of sight. Thank you so much.
Yes, thank you so much, Marc. And thanks again to the American Acupuncture Council. Virginia Doran signing off from luminousbeauty.com. And Yair Mamon is next week's host. So he's always got something interesting. I hope you'll check that out too. All right. Goodbye.
Bye.